Terry Schoenfeld for UAB School of Medicine. Prevention is classically divided into primary, secondary, and tertiary prevention. In this video, I will describe what each of these means. So there's this continuum of a disease, and going from no disease, where we then have the onset of disease. Usually there's some asymptomatic phase of that disease, and then we make the clinical diagnosis, and then we have our clinical course of the disease. And there's three main types of prevention that we talk about: primary, secondary, and tertiary prevention. Let's go through each of these. So in primary prevention, we're trying to keep the disease from occurring in the first place by removing disease risk factors. And examples of this might be immunizations. We might give folate to prevent neural tube defects. We might ask our patients to exercise so as to reduce the risk of cardiovascular disease. Might wear seat belts to prevent traumatic injuries. That's primary prevention. In secondary prevention, we're trying to detect disease that's already there, but it's asymptomatic. So here we're trying to do early detection and treatment of disease so we hopefully can prevent it from progressing to a serious nature. And this is what screening is all about, the detection of asymptomatic disease. So that's secondary prevention. Finally, a place we spend too much time in medical care is tertiary prevention. In tertiary prevention, we're focusing our clinical activities on reducing complications or the further deterioration of disease. And again, this is where we spend a lot of our time. So, for example, giving beta blockers post-MI to try to prevent the untoward effects of that myocardial infarction. This video has helped you understand the difference between primary, secondary, and tertiary prevention. Remember, if you have any questions, you can contact me through the course